Okay, so I'm going to share my screen. I have a brief presentation I want to share just to talk about TRU PACE, and we've been in the community for 3.5 years now.
Yep.
We are currently have over 200 participants we serve, and that continues to grow every month. And it's a program that was designed to really help support the most medically and socially vulnerable of our older adults in our community. And so I'm going to talk a little bit about TRU PACE, and then certainly I want to leave plenty of time for questions. So let me go ahead and get this up on the screen. All right. Okay. So not sure how many of you have ever heard of PACE. PACE stands for Program of All-Inclusive Care of the Elderly. PACE is a healthcare model that was designed by Medicare. It's been in existence for over 25 years now. It's in approximately 36 states across the country. PACE is a Medicare and Medicaid handshake program, meaning that the federal Medicare program and your local or your state Medicaid program have decided to come together to offer this program to Medicare and Medicaid beneficiaries in your state. So there are currently four, soon to be five PACE programs statewide. TRU PACE is one of the programs that offers, or is one of the organizations that offers a PACE program in the community. So as I said, it stands for Program of All-Inclusive Care of the Elderly. We are a service division of TRU Community Care. So some of you may know TRU Community Care as a hospice, formerly Hospice Care of Boulder and Broomfield counties. We became TRU Community Care back in 2013. And then in 2017, we brought on our PACE program. But as you can see here, we have PACE, palliative care, hospice, and support services, which include grief services. So we have a full line of programs that we offer at TRU that are really designed to support those who are aging, dealing with advanced illness or end of life in our community. Our unique mission at PACE is to support older adults to live successfully in the community they love for as long as possible. So we really are designed for folks who are aging and want to remain living at home or in their assisted living as long as possible. It's really designed for folks who want to stay out of nursing homes. And I don't know anybody, I've not met anybody who said my dream is to end my life in a nursing home. Everybody I've ever talked to says, I want to stay home. I want to be as independent and healthy as I can for as long as possible. And for that individual, that is where PACE can really step in and make a big difference. Sorry, my screen is a little pokey today. It's been a little sleepy since this morning. Here we go. So as I mentioned, the PACE program is a Medicare and Medicaid program. It's really special in that it is truly fully integrated healthcare. A lot of older folks, well, a lot of us who receive healthcare, you kind of get it in bits and pieces. One organization does medical care, another does dental, another handles vision, if you have those benefits at all. You go somewhere else for long-term care services or home and community-based services. TRU PACE is a fully integrated healthcare model where it's literally one-stop shopping. For folks who enroll with PACE, we truly take care of everything healthcare related that you need. And we really take away a lot of those challenges of having to be your own case manager or your own healthcare navigator. In the best of circumstances, when you're feeling well and you're in top health, it's complicated trying to manage your own healthcare as it is. But if you are dealing more with aging or having more medical issues emerging or mental health issues emerging, having to navigate a very fractured healthcare system is real challenging. TRU PACE takes all of that away. for the folks we serve. So you can see here we have a little picture of the front of the building, but to give you a sense of everything we do offer, this building that you see here is really the central hub of everything that PACE delivers. In that building, we have a medical clinic. We have a rehab gym that's fully staffed by a full rehab team. And we have a day program that is temporarily closed for the pandemic. However, that day program is a really vibrant place that is fully staffed with rec therapy, dietary, a full team of wonderful CNAs who just make every day fun. Folks come in and they just get to have a good time, lots of socialization, exercise, they can see their provider, they can pick up their medications, they can see their rehab team, whatever they need, but it's literally one-stop shopping that you can come to the PACE Center and have all of these needs addressed. We provide social services. We also have mental health counseling services for folks who need that. As I mentioned, the day center. Socialization is a big piece, activities are a piece, and then meals. We offer snacks as well as lunch. We are partnered with Meals on Wheels to deliver those meals either to the center every day or to participants' homes, wherever you'd like to take a meal. Transportation to and from medical appointments. This is where VIA is so incredibly critical to our operations. PACE cannot be PACE. TRU PACE cannot be PACE without VIA. And they are what makes the magic happen in terms of just making sure everybody's getting where they need to get the care and services they deserve. So we are eternally grateful to VIA for being on this venture with us. We have, in addition to all of this, we have a full in-network of specialists who, so if folks come to us and they have an oncologist or they need to see pulmonology or whatever their specialist may be, renal, it doesn't matter. We have a vast network of over 450 providers in the community and also in the Denver metro area to make sure that folks are as healthy as they can be and that they have full access to the services and medical care they need. We also have in-home assistance, and that is CNAs who can come to your home to help with personal cares as well as limited home care support. It's pretty task-based, so it can be anywhere from one day a week to a few days a week where you're going to have somebody who can come out and help with whatever you need. So, and along with all this, if in the best of circumstances, folks need a little more help and you need to go into an assisted living setting where you can have more around the clock support. We help cover that. And ultimately, some folks really do, as their medical conditions change, they do need to be in a nursing home as a permanent resident, and we help support that as well. So pretty much once you sign on with PACE, whatever you need and wherever you need to get to have the best days possible, that's what we do. So this is a nice graphic that I like to share just to give you a picture of kind of the philosophy of PACE and how it's been designed through Medicare and Medicaid. So the idea is that we really are designed at the center of everything is each true PACE participant. And around that person, we are working with our team, and I'll talk more about the team in a minute, to address their medical needs. We also address social needs, and that's why the day program's it's actually one of the foundations of the PACE program is that Medicare understands that for folks to be as physically healthy as possible as they age, you've got to have that social component. One of the greatest ills of growing older is isolation. And so socialization is a really critical component to what we do. The emotional support is there as well. So folks with any sort of mental health challenges, loneliness, you name it, we have support available through that, whether it's mental health counseling, social work, or even companion volunteers that work with us to help support our participants. And then certainly the physical. So helping people be as strong as possible, preventing falls or anything that can land you in the hospital. That's where our rehab team is so critical. And so all of these different disciplines are really involved in helping make sure each TRU PACE participant has what they need. People have come to us with different goals. Their goal may be to live as long as possible. It may be to be as functional as possible and be able to stay living independently for as long as possible. Or if folks are a little bit further along the trajectory and maybe dealing with a terminal illness, their focus might be comfort care. PACE can address all of these according to their unique care goals. To be eligible for PACE, you folks are 55 and older. Our TRU PACE catchment area is Boulder County and Southwest Weld counties, so Erie, Dacono, Firestone, Frederick, and Meade. So all of the Weld County communities that touch Boulder County are within our catchment area. A person would need assistance with 2 or more activities of daily living. So that includes bathing, dressing, toileting, whatever may be. And that at the time of enrollment, that individual is living safely in the community. That for the most part, most folks are living safely in the community when they need our services. If that individual is really needing something far beyond what we can offer and keep them safely in the community at that moment, we may not enroll them in the program, but that doesn't happen very often. For the most part, we're able to take folks in. So I'm good. I have a whole lot of pictures I want to share with you. And of course, I wanted to start with showcasing VIA in the front of the building. This is one of our participants and one of your drivers. And we have drivers who come in and out all day long, who know the participants really well, who know our PACE staff really well. And we truly see the VIA drivers as our partners, our friends, and our colleagues in helping make all of this amazing program work and happen. I do want to talk a little bit more, and I didn't put in a graphic for this, so I'm going to pause just for a moment. There is a full 12-member interdisciplinary team that every PACE participant has access to have the care they need. That includes physicians, nurses, social workers, dietary transportation coordinator, rec therapy. Oh my goodness, I'm missing a bunch. Our mental health counselor, rec therapy, all of our CNA team. So it's just this really large team. PT, OT, everybody comes together and we meet every morning to talk about the unique needs of any individuals at that time. So it's truly integrated care. We communicate with each other all day long, and always at the front of everything we do is what does each individual need to have a good day-to-day, to prevent bad things from happening, and to really be as well as possible. So that is our whole focus and our mission in supporting our participants. So I figured the best way to show you PACE would be to show you some of the pictures of what we do. So I'm just going to roll through a few things. And if anybody has questions, feel free to stop me. I just wanted to kind of show you a little bit of what we do. So besides medical care, folks are often, surprised to see that sorry about that, we offer dental. You saw that. Hold on just a second. My screen is taken off without me and I don't know why. This is our rehab team. Just a minute. Let me go back here. I wanted to be able to talk. So we have a wonderful rehab gym. This is one of our participants who is there regularly. This is the rest of our rehab team. Really great people. We have PT, OT, and all of their assistants that help us. Sorry, my screen is taking off without me. Hold on. In the center, in the day program, we play games. Bingo obviously is a standard, but we have a lot of other things we do. This is folks enjoying their ride home that afternoon on the VIA bus. We have arts and crafts, and this was Derby Day, I think, with one of our participants. This is Meals on Wheels. Sorry, I'm going to pause this because it's just getting a little bit too fast. Meals on Wheels, like VIA, helps us make all of this happen every day. They deliver meals every lunchtime, both at home and at the center. So they've been a really important partner in our services as well. We do have an intergenerational program. There are a couple local schools that we work with who have their students come over, and this was obviously pre-pandemic, but we understand and appreciate the benefits for older adults as well as the kids, getting to be able to have an intergenerational program where they can do things together. They have a talent, they had a talent show that was so fun. The kids came and they were judges with our panel, and our participants got up and put on a talent show, and the kids actually worked with some of the older adults to participants to determine who the winners were. So it was just really kind of fun, and everybody involved really enjoys that time together. We have pet therapy that comes through from time to time. We have a lot of parties, and conga lines are really part of what folks enjoy. These are members of our CNA team. This is about half of them. And we are so fortunate to have a lovely CNA team who just supports all of our participants when they come to the program. Sorry, now it's slowing down. Hold on just a second. My apologies, it's being fussy. We have an art program that is called, it's a local art therapist and rec therapist who come and help our participants with art. And this is every Monday, again, during the prior to the pandemic. But this is a really important thing that we enjoy doing every Monday. And we display their art. We actually now have an actual art gallery where everybody's stuff is in picture frames, and we have Zumba. We have different exercise and physical therapy groups that we run. So I could go on and on. There's so much to this program, but any questions, anything I can answer that folks might be interested in knowing more about?
Welcome to put into the chat too. If you feel more comfortable with that, I'll make sure your question is heard.
Absolutely.
Just because some people might not be familiar with your telehealth stuff, would you touch on that just for a minute? Because I think you guys were leading the charge in some of that work.
Absolutely. So TRU PACE, along with TRU Community Care itself, have launched a pretty aggressive telehealth initiative, especially this year with the pandemic. We had started it in the previous year, really just wanting to design it and get some more tools in place. But the pandemic has given us a unique opportunity to say, okay, we're going to do telehealth because it's so important that we're able to reach our PACE participants. All of our participants are in the risk group for the pandemic. And so we have a lot of folks who are really at home. Most of them live alone. And it's been more difficult for us to be able to reach them, for them to be able to come in safely or feel like they could even leave home safely. And want to come into the center. And their families are having more difficulty reaching them as well. Only about 7% of our participants are really comfortable or know how to navigate telehealth very effectively. And so what we've done is, thanks to the Page Foundation, as well as a couple of other community supporters, TRU PACE is in the process of purchasing a telehealth tablet for all of our PACE participants. And this telehealth tablet, you may have heard of it, it's called a GrandPad. And the GrandPad is uniquely designed for older adults in terms of its size. It's about this big. It's it has really big icons on the screen. So it says call TRU PACE, join bingo at 9, call my daughter. And it literally, it's a very simple touch screen with really big icons. So for low vision, low hearing folks, it's wonderful. For folks, if this is their first time ever interfacing really with an iPad type technology, it's very accessible. It's been tested on many older adults who are very similar to folks who are in PACE, and they've had wonderful successes. So it's really a win in terms of us and them being able to access us. And the whole piece around this social isolation right now with the pandemic, we really are seeking to impact that in a very meaningful way for all of our participants, in that they can easily connect to each other at PACE, they can connect with key friends, they can stay connected with family. So first and foremost, it's to help them folks feel like they're connected and engaged with people they care about and love, that they can continue to play games and join bingo and everything else they do at PACE, join exercise groups and all of that. It also has games built in to kind of keep people's minds sharp and engaged doing something fun. Eventually, the next step will also be that we will be building in some telemonitoring opportunities. So, for example, if a person struggles with depression, we'll be able to kind of touch base with them around how are they feeling, and then we can make sure they're getting connected with the resources through the PACE program that they need. So this is a really big thing that's coming. We're actually in the process of purchasing those devices right now. We are anticipating rolling them out over the next few weeks and into the first quarter of 2021. But we believe this will be a real game changer, not just for now in the pandemic, but ongoing. This is going to be part of how we help deliver services at TRU PACE that are just in time, the right kind of care at the right level, and just will be really embedded into the processes at PACE. So thank you for prompting me on that, Sunny, but we're really very grateful to be able to offer to this with the support of the Page Foundation and some others. So that's all I have.
I see that a Fire tablet has entered our waiting room recently. Is that a TRU PACE tablet? Or do you have no idea? Because that's also okay.
There's a Fire tablet. Is that what you said?
Yeah. Well, it just went away, but instead of someone's name, it said Fire tablet.
I don't think that's our tablets. We don't have the grandpads yet, so I'm not sure who that was, but yeah.
I can show you one of the tablets that we do have that we can get to the doctors, and the doctors will call us back on.
Yeah, we have another tablet called Vivify, and it's a really neat program. It's just a little bit harder for folks to use.
Sorry. Here's the picture of it.
Yep. So we do have a few of these in operation as well. And we're hoping to get the grandpads soon because we're anticipating those are going to be what everybody can easily use. So thanks for showing that, Joyce.
You're welcome, Sam. Any kind of help, I'm here to help us.
Okay. Thanks, Joyce.
But during the pandemic, we've got Zoom things, and we got things for phone, and the recreation people will send you a calendar every month for what is going on for the month. And today we're going to play bingo at 1:30, but I'm missing one of the things right now. It's a concert, and Dr. Wong and her daughter is putting on a Christmas concert. So it's kind of fun with everything that's going on with the pandemic and stuff. And TRU PACE has been there for me for the last 3.5 years that I've gone with them. So it's helpful.
Thank you so much, Joyce. Joyce is one of our founding members of PACE, and she's been an important advisor to us as well around how we do our programming, and we can always count on Joyce for input. So thank you, Joyce.
You're welcome, Sam.
I love those photos you shared. Everyone looks like they're having a blast.
Yeah, we are. We were.
Yeah, every day the focus is how do we make today the best day it can be? And I think Joyce would agree, we find reasons to celebrate pretty much every day, whether it's parties or games or you name it, we're finding we celebrate every holiday. We
Yeah, we
celebrate
do.
birthdays. Yes, every day we find something to celebrate.
Yep.
Any other questions or comments that I can answer? Okay, thank you for the time, Zoe. Thank you, Via. Appreciate it.
Thank you, Samantha.
Mhm.
Thank you so much for being here, for being in our partner spotlight. I always love learning more about these. Is the ecosystem of the community in our area is so large. I'm always learning about how we're working together, and then we're always learning ways to work together better. So thank you for being here.
Absolutely.